Hello everyone, welcome to Medical Education Nepal. Today we are going to discuss another disease, that is anthrax, and we will discuss the introductory part, the epidemiological determinants, the mode of transmission, the incubation period, clinical features, and the control measures. So, anthrax is a disease of the wild or domestic animals that is transmitted to man. So, it is also known as a zoonotic disease. Since it is transmitted from humans, animals to man, so it is known as a zoonotic disease. It is caused by a bacteria called Bacillus anthracis. So, these are the images of how an anthrax disease symptoms look like in an infected person. Now, the agent is the Bacillus anthracis. The reservoirs are the spores of Bacillus anthracis that may remain for years in the contaminated soil. The mode of transmission is by the skin infection, by coming in contact with the tissues of the contaminated animals, most probably the cattle, sheep, and goats, and also by the biting fleas who had partially fed on such animals. The pulmonary anthrax it results from the inhalation of the spores of the bacillus, whereas the intestinal anthrax it results from the ingestion of the contaminated uncooked meat. The accidental infection may occur among the laboratory workers. The incubation period is of 7 days. And now the clinical features, the cutaneous anthrax, the gastrointestinal anthrax, the intestinal or the pulmonary anthrax. So for the cutaneous anthrax, the skin single lesion is developed as an irritable papule. You have seen in the first image, uh, the lesion was there, and this progresses to a depressed blackish stir. Despite extensive edema, pain is infrequent. Pain is not that frequent. And for gastrointestinal anthrax, the nausea, vomiting, anorexia, fever, abdominal body pain, and so on. For pulmonary anthrax, the fever, dyspnea, curved headache, and the pleural effusion. The control measures are the enforcement of health measures in the industries dealing with skin, wounds, hairs, bones, and bone products, the vaccinations of the animal at risks, awareness programs, and the vaccinations of higher risk people, notification, and disinfections. So this was all about the anthrax topic. It's not so long and it's not that much important. However, the zoonotic disease is very much important for the written questions as well as for Viva. So this was all about today's lecture. I hope you guys liked the video. Thank you.